On this episode, I'm reacting to this article titled Stop Making Such a Big Deal About Going Back to School by Dr. Samantha Boardman. All right, this is what she says. Every August, the same ritual begins. Parents frantically Google back to school anxiety tips. Schools send home preparation checklists. Mental health experts pub articles about the inevitable stress of returning to the classroom. Children are bound to experience anxiety, that the transition will be jarring, and that we must watch for behavioral warning signs indicating distress. Yeah, one of the movie or morning shows that I go on regularly, they're like, hey, can you come on and talk about like emotionally preparing your child to go back to school? And I'm like, sure, but we're going to probably follow more along these lines. But what if all this well-intentioned preparation is backfiring? What if by treating back to school as an inherently stressful experience requiring extensive emotional support, like I just said, we're actually teaching our children to expect and therefore experience exactly that stress? That's exactly what we're talking about. And so I really changed up the talking points that I gave the producer because of this very thing. The expectation effect in action. Research on the expectation effect reveals a powerful truth. Our predictions about experiences often become self-fulfilling prophecies. When we expect pain during a medical procedure, we feel more pain. When we expect a social interaction to be awkward, it becomes more awkward. And when we spend weeks preparing children for the stress and anxiety of returning to school, we're essentially training their brains, anticipate, create those very experiences. Consider the language saturating back to school messaging. Experts warn about the social and emotional summer slide as if children regress during vacation. Middle school transitions are described as inevitably difficult, with parents advised to prepare for the shock of multiple teachers for different subjects. We're told to monitor for uncharacteristic sleep disturbances and increased defiance as signs to back to school anxiety. The irony is striking. In our effort to protect children from stress, we're potentially manufacturing it. Next subtitle. When normal becomes pathological. There's nothing inherently traumatic about getting a new teacher, walking between classrooms, or adjusting sleep schedules. Humans are remarkably adaptable creatures, especially children. For millions of kids throughout history, September simply means returning to learning, no extensive emotional preparation required. I love her use of adaptation. I'm sure you're shocked. Yet today's messaging suggests that without careful intervention, children will inevitably struggle. One recent article opens with a detailed case study of a 9-year-old feeling anxious as the school year approaches, immediately priming readers to expect similar struggles in their own children. Parents are warned to watch for a laundry list of concerning behaviors, headaches, nausea, fatigue, or children who seek continual reassurance about what their school day will look like. We're pathologizing normal developmental experiences, turning routine adjustment into cause for concern. A child who seems quiet after the first day isn't just processing new experiences, they're showing warning signs. A kid who takes time to warm up to their teacher isn't displaying normal social caution. They need supportive strategies. We're doing this all of the time. So we're taking things that used to be, say, social awkwardness. And back in the 1980s and the 1990s, we were just like, oh, that kid's like an odd duck. That's cool. Let them be an odd duck. But now we're slapping a label on them and we're telling them that they're on the autism spectrum. And I'm like, stop it. And we're doing this all the time. We're saying that kids who used to daydream, and daydreaming is actually good for our kids. Daydreaming is now, oh, they have ADHD. No, their brain just needs a break from the stimulus. And so they're looking out the other way. Are they not following through? Yes, but they can probably catch up with a little bit of understanding. But instead, we're slapping these diagnoses on these kids and it's hurting them. We're taking normal behavior and we're saying that it's pathological, and we're saying that and what we're not unintendedly communicating to them is that they're broken. And this is so problematic. We need to stop this. We need to stop taking normal behaviors in kids, such as anxiety. Everyone experiences anxiety, and saying that they have some kind of psychological disorder on it. That's one of the biggest things that I think we need to stop doing. Okay, next subtitle. The confidence gap. When we consistently prepare children for difficulties they haven't yet encountered, inadvertently communicate a lack of confidence in their abilities. The subtext of this endless preparation is clear. This is going to be hard for you. You probably can't handle it without help. I was just having this conversation with one of my clients, and she was saying, she was worried because her tween was going to start a new school. And she's like, can we talk about this? And the tween was like, I'm fine. And I was like, okay. And so I heard the tween. And so I decided to support the tween and kind of educate the mom of like, hey, let's just see what happens. Let's adopt that mindset. Instead of going in and thinking, having these jumping to conclusions and these preconceived notions that it's going to be awful at this new school for your child, why don't we just sit back, take an observer role, and let's see what happens. And so I don't know what has happened yet, but I'll let you guys know. Children are intuitive. They pick up on our anxiety, our excessive planning, our worried expressions during practice runs to school buildings. They internalize the message that going back to school is something to fear rather than anticipate or even look forward to it. Research on academic mindset shows that children perform better when adults express confidence in their capabilities rather than constantly preparing them for failure. Yet our current approach does the opposite. Oh, goodness gracious, does it. It primes children to expect struggle and positions us as the experts on their emotional states rather than trusting them to navigate new experiences. This is why I hate the word adversity, and why when I coach high school football, it's a word that we never use anymore. Because what it has taught us from experience is that when we say like, oh my goodness, we're going to face adversity this game, what happens is my players all of a sudden go back and they're playing on their heels, and then they're just they're waiting for themselves to mess up, and it's not good for them. And so what we do instead, we never use the word adversity anymore. We use adaptability. We're going to go in, we're going to evaluate the situation, and then we're going to use our training and our preparation and our skills, and then we're going to overcome it. No more adversity, because it's just, there's no guarantee that we're going to actually face adversity. But if you go looking for it, well, yeah, you're going to face adversity. The rumination trap. When we encourage children to identify their negative feelings about school, monitoring their anxiety levels, and prepare for social difficulties, we're inadvertently teaching them to ruminate by repeatedly focusing on potential negative outcomes. Put simply, excessive focus on potential problems increases their likelihood. Studies show that rumination is a key factor in developing anxiety and depression. Encouraging children to constantly examine their emotional states and prepare for difficulties, we're training them in a thinking pattern that is linked to poor mental health outcomes. One expert actually advises parents to watch for subtle behavioral shifts, like child having a more difficult time falling asleep or finding previously enjoyable activities particularly challenging. Essentially, teaching hypervigilance about normal fluctuations in mood and behavior. I mean, there's a way to kind of know when you've crossed the line from normal behavior into dysfunctional behavior, but it has to deal with, like, are they performing worse in school than they usually do? Are they not being as social as they usually do? Are they, for teenagers, are they missing out on work, and are things more like, but it has to be pretty extreme. And usually I say, like, let professionals in on that. Don't just assume that they have some kind of diagnosis. What actually helps? A more effective approach is to trust children's natural resilience and address problems if and when they actually arise, rather than creating elaborate systems to monitor and manage difficulties that may never materialize. Yes, I love it, Dr. Boardman. This isn't an argument for negligent parenting or ignoring genuine difficulties. Some children do face real challenges with school transitions, and they deserve support. For most kids, the best back-to-school preparations is surprisingly simple, and here they are. Express confidence. Instead of asking, are you worried about school? Try, what are you looking forward to this year? Rather than preparing for problems, communicate your belief in their capabilities. Yes, I love that. That's what I'm going to be talking on the Good Morning show of Toledo. Keep it routine. Treat back to school like any other seasonal transition. Adjust bedtimes gradually. Buy supplies. Meet the teacher. No drama required. Love it. Model calm. Children regulate their emotions based on the adults around them. If you're anxious about the return to school, they will be too. If you're a matter of fact and positive, they're likely to follow suit. If you're just like, oh, it's just another day, it's just another school year, that's okay. It's not minimizing. It's simply saying like, hey, you've done this before. You can do it again. You've got this. We've started school before, unless your kid's like a preschooler or a kindergartner, then it's different. Trust the process. Most children adapt to new situations within days or weeks, regardless of preparation. Human beings are wired for adaptation. It's what we do best. Yes, I love her word of adaptation. Last section, rewriting the narrative. Imagine if we approach back to school with the same energy we bring to other positive life transitions. Instead of articles about managing anxiety, what if we celebrated children's growth and new opportunities? Rather than preparing for problems, what if we focused on possibilities? I love that line. Rather than preparing for problems, what if we focused on possibilities? The shift isn't just semantic, it's psychological. When we expect positive outcomes, we're more likely to achieve them. When we approach challenges with curiosity rather than dread, we build resilience rather than fragility. Our children are watching. They're learning not just academic subjects, but also how to approach life's transitions. Are we teaching them that new experiences are threats to be carefully managed or adventures to be embraced? The bottom line, I know I said the last section, but this is the last section. The bottom line, going back to school isn't a mental health crisis. It's September. Children have to be doing it successfully have been doing it successfully for generations without extensive emotional preparation. Research on resilience shows that children are far more adaptable than our current anxiety-focused messaging suggests. By treating normal transitions as inherently problematic, we risk creating the very difficulties we're trying to prevent. The most powerful gift we can give our children isn't another coping strategy or anxiety management technique. It's our confidence in their ability to handle whatever comes to them. Here's the thing. I always talk about like the psychology triangle, right? Your thoughts, your feelings, your behaviors are all interconnected. If you are focusing in on the feelings of like, oh my God, we're going to be anxious, we're going to be anxious, we're going to be anxious, that's going to feed into what their thoughts are. And then that's going to feed into how they behave and how they approach things. And if we behave in that certain way where we think we're going to be anxious and we're feeling anxious about it and we're behaving that, well, then we're going to start behaving in that way. And then guess what happens? That thing that we're fearing actually happens. So if we think about it as a possibility and we are like, okay, what can this new school year bring? It can bring us new friends. It can bring us a great relationship with our teacher. We can learn a whole lot. We can, flex our problem solving skills. Those are the things that we want to be focusing in on. That's going to breed, if we go into the psychology triangle, if that's what we're thinking, then we're going to be more confident. They're going to be more positive about going back to school. And then they're going to approach school in a positive, adaptable way instead of the dread. So by doing this, by focusing in on the possibilities, by adopting that let's see what happens. There's no problems. We're just going to see what happens. Accept that mindset. That is the number one tip that I want you guys to take away from this. My reaction to this is let's adopt a let's see what happens mentality this school year. And by doing that and training our children to do that, and by us doing it ourselves, we're going to be throat punching this Gen Z mental health crisis. Let's go.